Welcome to the Journey Mindfulness Podcast. I'm your host, James O'Neill, aka Jimbo, and we're going to explore today the interconnectedness of mind, body, and spirit. Today, we delve into the powerful concept of movement is medicine. In a world dominated by sedentary lifestyles, we often overlook the profound impact of physical movement on our overall well being. From ancient civilizations to modern science, the healing power of movement has been recognized for centuries. On this episode, we're going to explore how incorporating mindful movement or intention into our daily lives can transform our physical, mental, and emotional health. We'll discuss these benefits and various movement practices from yoga. Just kidding, maybe not yoga, but I wanted to throw that in there. It's strength training. Join us as we uncover this transformative potential of movement and discover how it can become a catalyst for a healthier, happier you. And I'm thrilled to have a very special guest, Dr. Jean Shirokobrod, an entrepreneur and physical therapist and the CEO of Recharge Modern Health and Fitness, among other things, in Howard County, Maryland. Also, the host of the Movement is Medicine podcast. And in general, one of the good guys in healthcare. So welcome, Dr. Jean.
Thank you, Jimbo. I like how is that part of your intro every time?
No, man, I just make it up.
I didn't think I heard that one before. So that was not, I thought it was because I usually call you Jimbo. So it was a nice little introduction, even though you hesitated on the spirit portion of the mind, body, and your spirit. Like I wouldn't be willing to talk about the spirit, Jim. I take offense with that.
It's very mindful to pick up on that hesitation. And
I'm very present.
Well, that's good to know, and that we can dive into that as well.
Can't wait.
So I guess what I wanted to start with is that, how I sort of found Recharge was that it was like during the beginning of COVID, towards the beginning of COVID, I guess. And I was feeling very lonely. So mentally and physically, like, alone and disconnected from the world, as I'm sure many people were. And one day I saw some people and some rowers rowing in the parking lot near my office. And I'm like, what is going on here? And eventually came to join Recharge and this wonderful community that you built. And so it was a really a savior for me at that time. Like, wow, there's like all these people here that are, helping each other out and be healthy. And so it was a really, really special thing. And it's been a very beneficial part of my life. So first, I guess I would say thank you. But then I also want to ask you, what was the idea, the origin story of Recharge? How did you come to creating that? Because it's different. It's a different kind of place. So it's unique in that way. So maybe you could go into that story and just talk about that origin.
Well, first of all, thanks for sharing that. That means a lot to hear that. Obviously, that's what we're here for, is a level of the human connection. And I think a couple things you said will resonate, will be a thread line through the origin story, is disconnect and loneliness were two big words that I heard from you. And COVID taught us that, right? COVID taught us that we are social creatures, right? We're still designed to be together. And ultimately that comes back to the question of what is health? How do we define health? How do we define healthy? And for most people, the answer is, unfortunately, usually when unhealthy happens, right? If you ask most people is what is healthy, they'll usually describe aspects of it, of, hey, being fit or eating well, or, sleeping, or, some aspect of it. But the real answer is those are cogs in the machine, right? Health is a multi aspect system that has to be a proactive machine fed into you. And unfortunately, we, as in Western medicine, Western society, is designed on a reactive system. So I was part of that reactive system. My background is I'm a physical therapist. I went to PT school at the University of Maryland School of Medicine. Loved it. Like, my focus since high school was I wanted to be a physical therapist. Like, I knew what I wanted to do. And my mindset at that time was I wanted to work with my hands. I wanted to be a manual therapist, and I wanted to fix people. Right. That I had this process of that I have control over somebody else's body. And I started working in the clinic after I graduated. I got certified in manual therapy. I went to like hundreds of hours of continuing education. Like, I built this reservoir of knowledge of musculoskeletal and neurological information. And then I got into the clinic and I started working, and I loved it. And I worked with my hands, and I started fixing people. People came in with pain and then they left without it. And I did that for years. And then after doing that for years and seeing thousands of patients a year, I started to realize, and this dawning started to happen on me as I was writing the Dunning-Kruger wave. Um, I was like, what do I actually know? What am I actually doing here? Right? You start asking these questions because I would fix people, and then 3 or 4 months later, they would come back with a different issue. Or I would work with them and their pain would go down to a certain amount, and their insurance company would be like, well, we're not paying for any more sessions. I'm like, whoa, who's in charge of the person's well-being here? And
Yeah, how is this helping that
exactly.
person? Yeah.
It became a financial decision. So I started getting these whispers, these tentacles started being planted in my head as I don't want to discharge people, because I started building relationships with these people, right? In no other part in your life do you go, well, we spent 8 weeks together. I'm going to discharge this relationship now. We're done. Thank you. Thank you for hanging out with me for 8 weeks. But medicine is kind of based on that, right? Because it's a reactive model. We
Oh, it's even worse in mental health. We call it
You
termination.
call it termination?
Termination,
You
yeah.
terminate
Well, there's
somebody?
discharges like
You go
termination.
full Arnold Schwarzenegger on them? You're like, I'm the Terminator.
It's just a term that gets taught. It's like, whoa, it's just harsh
That is
sounding,
very
right?
harsh. That is
Not very
It
mental
is not
health
very mental
sounding.
health. No. Terminate them. So I was like, this doesn't pass the smell test, right? It just does not smell right. But it's the machine. It's I know I keep saying the word machine a lot, but it's true. It's the medical industrial complex, and that's what we're forced into. So I was like, I don't want to be forced into that anymore. What I enjoy the most is the relationships with my patients, is them coming in the next day or the next appointment going, hey, couldn't wait to tell you about the movie that I saw that we were talking about before. Or, hey, my daughter had this game. Here's how the results were because I knew you were interested, right? Like those human aspects became as critical for me as possible. And then I started to shift my focus in education as well. Instead of going about the body and biomechanics, which I felt like I had a pretty good grasp on, I started looking at what pain really was. I started to study pain. And what I realized was what the latest evidence of pain science was is that pain is an experience. It's even if something physical happens, if you roll your ankle, the experience of pain is just your brain's ability and system to process danger. So pain is not a physical thing. There is no pain receptors. There's nociceptors that feel different threat, but pain is not about that. So then again, I started to go deeper and go, if people are in pain and pain is an experience, and people are fed so much fear and misinformation and this disjointed information about what health is, what can I do to, instead of trying to get them to a baseline level of pain free, what if we go in the other direction? What if we proactively keep them healthy and engaged in a community and never discharge them? What if we keep them healthy for 20, 30, 40 years into the future by building relationships, by building community, by looking at multiple aspects beyond musculoskeletal health or pain? And that's kind of when the idea for Recharge really started to come into my mind. And that was probably mid 2010s, 2013, something like that, 2014. And then I created a product, did like Shark Tank, and then like kind of went the entrepreneurial route, and then double back in like 2015, 2016, and really started to conceptualize Recharge until we opened it in 2017.
Very cool. Yeah. That's it's like one of those things that you hear about sometimes, right? Where it's like, be the change you want to
Mm,
see, and you are in a model. And I think a lot of times, at least in the mental health realm, doctors and therapists are like, well, this is the way it is. And they just kind of accept that, when it's like, well, what if you could change it? What would that look like? And then starting to brainstorm and actually put ideas into action that are meaningful and ultimately fulfilling for a lot of people.
100%, 100%. And the thing that pushed me over the edge was really the question of how much good am I really doing? And the realization was that all the time that I spent learning my methodology of fixing people really didn't fix anybody. You don't change tissues with your hands. You change the sensation that your brain is processing. So all I was doing was creating an environment in that moment for somebody in their body, right? But our bodies are so resilient. But the thing we tell our members, especially when they first start out, is you have to remember what your body's designed to do, and that's to not change, right? Our bodies are designed to maintain a homeostatic environment. We're designed to maintain status quo. And then anything away from that status quo is either going to be perceived as dangerous, and your body has to adapt and adjust, typically through an inflammatory process, or it becomes a false positive. So people, go for a walk, or they're like, yeah, I move around at work. I'm always active. But if it's not moving the needle, if it's not challenging your tissues, you're just creating a false positive. So you're not disrupting that homeostatic environment. And a lot of times in the clinic, especially the way I was treating, and there's nothing wrong with it, it's effective, but there was a disconnect between what I truly thought was happening and what the reality was different. And I couldn't move past that, right? I took the red pill and there was no going back. Like I knew the truth, and then I just could not live in that reality anymore.
Yeah. I kind of want to unpack that a little bit. You knew the truth. So you knew what was going on with their bodies, like outside of just the actual like thing that they were there for, what you were working on.
And the reasoning, right? That before, if I did a spinal manipulation, it was like, yeah, your joint is repositioned, or we moved your joint back. And then the reality is the joints don't really move that much. And you hear a crack, great, but that's some gas leaving. But what's truly changing the perception is your brain and your nervous system. And the way I explain the procedure and the things we talked about after the procedure were just as important as the technique itself, right? So this idea that I was fixing people with my hands was a false narrative in my head. I was not fixing anybody with my hands. My hands were a mechanism, a cog in this process. But what was truly helping people was the way I explained things, the way I listened, the way they bought into it, and more importantly, if they felt like they were the hero in the story and I was the guide, right? If I helped them understand what was happening and help them empower the process, that they were in control over that process, that's when they started to get better much faster, right? So this idea of fixing people was about me, not about the patient, right? It made me feel good that things that I learned, the things that I worked on, the results that I got. Um, and I was like, I. And I was like, there's something wrong there. Right. So I had to accept the mindset that it's not about me, it's about the patient and the person in front of me. And then once I asked that question, if it's truly about them and it's not about what I'm doing and their body's resilient and it's really not changing, so what the heck's going on? Why is change happening? Why are they getting better? And that's when I started to kind of go through this process of what is actually happening, not what do I want to happen.
Wow, that's high level stuff there for the folks listening. And maybe is that part of every sort of healer's journey in some sense, is like, I'm going to fix this, but it's not really me, right? It's giving the patient or the client the autonomy to empower themselves on in that path.
I think so. I think there's a reason most of us get into a healing or medical profession. I think that there is some underlying piece to it. And I think once you figure that out and you're willing to ask that question of what's it for, and for some people, it's simple. Like some people want to get into a medical profession because it's a job and it's usually a safe job and it pays well, and that's fine, right? You can be a serviceable clinician and be perfectly smart and capable and do the job and not feel like it's your mission in life, that it's a job. That's okay as long as you're competent and proficient. But I think if you see it as more than that, right? And I think that that's the difference between a clinician and a healer, maybe. Um, it's a deeper connection. And I was after the connection more than just logging in the hours, right? And just going through next, who's next, who's next, who's next. That was not scratching that itch for me. So I wanted something deeper, and that's what I try to figure out what that was.
Feel like you just dipped into that spirit category a little bit, but
I don't know. You hesitated on that, so I'm hesitating even discussing that.
don't hesitate. No, but that connection, right? So in the introduction, I talked about interconnectedness, but one of the big aspects of mindfulness based stress reduction when you go through a course is the interconnectedness or the interdependence of all things. Like we're all connected. And once you start to feel that, there is a felt emotion. Typically, it's more like love. You talked about pain management, and love is a part of that too. Whether it's loving your body and or befriending your pain in a way.
Yeah, that's a great highlight. And I think you're right. And we do talk about this quite often because pain is experiential, so it's experience based. Um, it's a pain experience, so you have to have a relationship with your pain. And I think if you understand, again, coming back to this idea of understanding in order to empower, if you better understand pain, why it's happening, time frames, and a process of it, then you can start building a relationship with it instead of fighting against it. Very much like a current, right? You sometimes you can't change the current, and sometimes you can't change pain. Actually, most pain is what's called insidious, meaning it just starts. And one of the hardest things for us to teach and people to understand is that you can have hurt without harm, that you can be hurt and you can be in pain without tissues being harmed, because most pain, think about chronic pain, right? It takes, even the worst injuries, if you break your bone, it takes 4 to 6 weeks to heal, 6 to 8 weeks if it's something serious. If you have surgery, it might be a couple months. If you have tendon issues, it could be 3 months. But people have pain for 4 months, 5 months, 8 months, 10 months, 12 months, even longer. I've treated people in pain for 20 plus years. Your tissues are healed up, right? But this concept of pain is still there. This danger signal is still there, because you're in an unhealthy relationship with that part of your brain. You haven't allowed it to move forward. You haven't allowed to reestablish a new homeostatic environment, and that's exactly what your brain and nervous system did. It said, here's this level of hurt without harm anymore, and now we have pain. And that's hard to work through. It's hard to work through for people. But there's ways, right? We give people analogies and metaphors and things like, if you
Sure.
lose a limb and you still feel pain in your toes, but if you don't have a leg below your knee, how does that work? Right? There's still pain, but there's no tissue. So phantom limb pain. We talk about eating something spicy. Or if you eat something spicy and your mouth is on fire and you're in so much pain, then you open your mouth and there's no harm.
Like mustard, Skittles.
Oh, that was an experience, Jim. That was It tasted like mustard though, right? Like it was really, really good in terms of that.
I walked into the gym one day and someone said, "Hey, there's a mustard Skittle," and I honestly thought it was a joke. I didn't realize that that was an actual thing, or however that I don't even know how the that came to be. But it really did taste like
Yeah, one
mustard.
of our members, Karen, works for McCormick, and she gets sample things. So she brought in a pack of I don't know if they were testing it or it was for a I think it was from a promotion with, I think it was Heinz mustard. And she's like, "Hey, try these." And just out of, a man of science and testing, I had to understand it for myself because I don't really like candy. I don't eat sweets really. And it tasted like shockingly like mustard plus Skittles.
I
It
know.
was it was actually kind of amazing how well they nailed the mustard taste.
Yeah. So, and what I mean, there's a lot of reasons why I, love and appreciate your gym. Um, but one of the things is mindfulness, and um, that it was a sort of point, like this recognition on you guys' end, like, okay, the mental health game matters. It's a big deal, especially talking about pain and what people are carrying in their bodies and all things that come out when you start to move things around, that will start to pop up. One of them is the beginner's mind, and I'm pretty sure it was, like, the first time I met you that you kinda brought that up. It's like we have this idea of what our bodies are capable of and what we feel, but until we start actually moving it and doing it, we don't really know. But yet we all have this story that we're working with.
Yeah.
So where did that come how did that kinda come up for you in your practice or in your concept of, okay, like, this mental health and how people, relate to that?
Yeah, that's a great question, and I'm glad that that experience stuck with you. Um, it really was part of that evolutionary process in my approach to health. After I spent so much time in the physical and in the mental or the musculoskeletal, and then the nervous, and then the pain, and then the natural progression. When you start learning about pain and you realize it's so experience based, you also see the direct connection with mental health, right? That people with mental health challenges have a much more ramped up, uh, called sensitive nervous system. There's a level of sensitivity there, and that was my bridge to mental health, right? I went from this physical, and then I saw that people in pain typically have some level of mental health challenge. So then I was like, wow, I really need to learn about mental health and psychology, and then I started to get absolutely fascinated by behavioral psychology. I mean, that's where all my light bulb moments happened, right? Those were the gaps that started to get filled in the musculoskeletal that I had. Like in the beginning that we talked about, it's like I just needed the answers and I couldn't find them in just the tissue physiology and the biology and the physics. And then mental health and behavioral psychology was like, this is amazing. This is amazing. I think one of the first books I read that it was huge, and I read, and I think I read right after that, it was Thinking Fast and Slow by Daniel Kahneman. And I was like, wow, this explains so much. And then Body Keeps a Score was really good about trauma and how that manifests itself physically. And then I was hooked from there, and I started going after it. And then you just start, once you branch out of your tunnel and you start looking how outside of the tunnel impacts the tunnel itself, right? Like there's a lot of outside. If you're driving through a tunnel that's underwater, you're you're covered by an ocean, right? But you're still focused on this one path. So I started to kind of look at the ocean around the tunnel, and that was mental health. And there's this concept that I learned. It was called the mental time machine, where people get really frustrated and they get into this mental time machine and they go into the past. They go, here's how I was. Here's what I used to do. Here's the things that I remember myself doing. And there's also the negative of that is here's the things that hurt me. Here's the things that have created this negative experience, and they go back into that. Then they go in the other direction in the future in the time machine, go, here's the things that I want to do. Here's the things I can't wait to do. Here's the things I'm frustrated that I can't do. What they don't do is stay in this moment and go, and here's where you are now. It doesn't matter what you were. It doesn't matter necessarily what got you to this point. Being aware is good, right? Don't push those things down necessarily, but you still have to walk the now, right? You still have to accept this is what your body's capable now, and you have to figure that out in order to change that present consistently. And I think that's part of the empowerment process, is helping people, giving them permission. That's what we always say, right? That was the one big thing. I even wrote an article on this. Is the biggest thing we have, the biggest superpower we have as physical therapists is to give people permission to do. And once they accept that and actually do it, that's when good things happen.
The past does not equal the future. It's so easy to drop into story and get stuck there and live in it, even though it's not the now
Yeah.
moment.
I'm guessing you do that a lot with clients, right? Like they get in this loop. It's hard to break it.
Yeah, there's a technique called mental noting. It's a meditation, but it's, you're observing, sort of like this, metacognition, right? So you're observing what's happening in your mind and how many times you go into story, right? Like, I'm this or I'm that or this happened or this is scary or I can't do this anymore, and then it's like, okay, in the now moment, what if I could? And give it a shot. And then you prove yourself wrong in a sense, but that just being able to label that in a way like, okay, that's story. That's not that's not reality right now. I'm not in the past, like the injuries, like I've had so many injuries. They loom in your mind and in your body. But
Hmm.
in the now moment, it's like, all right, do this lunge. Everything is connected. It's gonna hold up. You just gotta trust your body
Yeah. And it's
and
that's a
not
mental
get
load
sucked
as
into
well,
that
right?
story.
To trust it and then do and then deal with the after effects of it. Like the actual action is the easy part, right? Oftentimes we tell our members the hardest thing you're ever going to do at recharge is walk through the door. Like that's much harder than any exercise you do. That everything that leads up to that of getting you through the door, that's usually the hardest for people. But um
That's the only reason you're on this podcast right now,
because you walk through the door.
because I walked through the door.
That is true.
So, I was in a freak wiffle ball accident a couple months
That's a way
ago.
to frame it.
What else do you say? I mean, like, I remember the first time I had to, like, actually, like, say it to people. I'm like, "What happened?" I was playing wiffle ball on vacation with friend or my family and children and fell down a ravine in boulders and crashed into a tree and scraped myself up and really,
Yeah.
really injured myself. And then walking into the door again was a barrier. It was a psychological barrier. Like, all right, we're coming back. And you gently encouraged me, which is always fascinating to me how you do that with people. It's like, how do I get this, like, motivate? I guess is it motivation, discipline? Like, hey, come on back, and like creating that space, that sense of safety. Like, all right, walk through the door. We got you.
Yeah, I mean, I like to rely on guilt usually, that's usually a go-to, just guilt people into it.
Sarcasm.
Yeah,
Yeah, I'm just kidding.
no, I think there is no one strategy because that's the whole point of relationships, right? We know every single one of our members because they are to a large extent friends at this point. I think I can't remember who I was joking around with. Um, that I, I was joking around that majority of my life I spend with friends that pay me money. That's what it is, right? So I you have to subscribe to the idea that sometimes you have to do and say what's best for the person and know that their reaction might not always be ideal, but you still have to do it. That's kind of the biggest thing. And when you're the guide and not the hero, when they are the hero in their story and you're the guide in this portion, you have to do what you have to do, even though the effect might not be great initially. And sometimes that's the case. Like when somebody's going through something and they're not necessarily ready to do what you feel like and from an evidence standpoint know is best for them, but they might not be quite ready for that yet, right? So you have to do everything along the way, and sometimes it's being persistent and annoying, and texting nonstop, and being sarcastic and joking, and all those things until the opening is there, and they go, finally, okay, now I'm ready to walk through the door. So all that to say is you just have to be there, right? Like you just have to be there, and the person knows that you'll be there no matter what. And you just have to kind of match their energy to that point.
Yeah, I mean, there's the concept of non-attachment to outcome. It's like you're taking a risk, you're doing what you believe is right to help them, and letting go of
Yeah.
that, and sort of trusting that things are gonna then it gets into patience that things are going to unfold in the right time.
And that's hard, right? Because you give up some level of control when you're doing that, and that's why you have to have this idea that it's not about me, because you're giving away one of the things that we as humans have an insanely hard time giving away is this idea of control. But it's true, right? You are brick by brick laying a path back, and you have to accept that you might not know how many bricks it takes for this person, but my job is to keep putting those bricks down and hope that it doesn't take an entire store worth of bricks, that it's just a few. But sometimes it does, right? Sometimes it does. And we've had people come back after a year or 2 years because they've gone through some stuff, and it's just consistently checking in and seeing how they're doing. And eventually they are at the point where they're like, okay, I have enough vulnerability now to go. I can come back and accept the repercussions, and usually internal repercussions, right? Of how they will feel in that moment, in that space. And that's a scary thing.
Well, it's a big hurdle and a challenge for a lot of people to face our fear, but that's where we see the most growth mentally and physically as well,
Mm.
for sure. Um, I wanted to highlight you just talking about mindfulness and mental health. One of the things that I know I'm not alone in this, but truly appreciate is recharges, and really it stems from your leadership ability to adapt to the needs of the community. And so, menopause is one of those issues now, that I see with some of my clients who are females that are going through things, and finding gaps in sort of Western medicine and what knowledge is out there. But then you guys taking the lead from the community and like adapting that and changing your approach and how you address things as needed. I think I really just I wanted to highlight that, and maybe you can talk a little bit about what that was like for you. But it was very impressive to me how you guys have worked with that.
Well, thanks. I mean, it's still a slow process. There has to be some level of methodical in any addition or change, right? Because one of the big things of people and community, and especially being a place of consistency, is you have to be consistent. You have to have a level of sameness, right? Because people feel comfortable in routine, and people feel comfortable in knowing something is there, and that's important, especially if we truly see ourselves as like a third space or a big important part of somebody's life. That we have to show up, we have to be here, and they have to have some level of understanding what they're going to get. So change is very, very slow, even and for us as well. But conversations don't have to be, and listening doesn't have to be, and individual integrations doesn't have to be. And then as commonalities start to happen, you have to start kind of mentally tracking that and saying, here's a difference that's starting to emerge. Here's a pattern that's starting to emerge. And that's really all medicine is understanding patterns. And ultimately you have to go, okay, if I adapt to this new pattern, how does that affect everything else? If I avoid this new pattern, how does that affect everything else and everyone else? And at some point you have this inflection point where you're like, I have to make an integration. There has to be some level of change. And menopause was certainly one of those. And it's still a process, right? We're still in the learning phase of it. And we have over 60% of our communities women, and our average age is mid 40s. So it's a very large population. And over the years, I've had more and more women talk to me and ask questions and start to ask for answers. And I started to dig into it myself, and I was amazed and shocked, and then also amazed and shocked that I was amazed and shocked by the results, um, which I shouldn't be. Like I should have known that women are underserved and they don't have the same amount of focus in modern medicine as men, and all research and happens from men up to this point, most of it. And menopause is just one of those things where their providers go, this is part of life. This is part of the process. Deal with it, suck it up. And that's not good enough. And we have a unique situation potentially in knowing and seeing our ladies more than any other clinician in their life. And it's the process is coming up with solutions by first truly understanding the problems, the functional problems, and giving them a voice, and that's kind of what we're doing now. Is the next phase of figuring out menopause solutions is truly understanding the problems and the day-to-day lives of women that are dealing with that. And it's going to start with like anything else with a conversation. So we're going to do a big forum for our members and hear them out and see what they've been going through and things that they haven't been able to figure out, and how they've been dismissed by a lot of medical professionals, and then creating a problem list, and then doing what we do best is looking at the research and evidence of what does exist, and then coming up with some solutions and testing them out, right? And it's just kind of following the scientific model. You come up with a hypothesis, you come up with an objective that you want to accomplish, you come up with an experiment, test it out, and go from there.
Well, there's a willingness on your end to, adapt, which is a big deal. And there's a lot of elements with just listening, like you said, to the community, giving them a place where they can share their voice and creating like a safe container for that. Those are all things that are not easily or dynamics that you really have to be intentional about. Um, so I wanted to highlight that as one of the features of the gym is that you guys are not afraid, even if it takes time. All good things do that to do that. Um, Gene, you have started a golf program, and I just wanted to see if we could shift gears and just kind of touch on that a little bit and see what you guys are doing, what you found with that, what's exciting about that for you guys.
Things were going so well up to this point. It was such a good, well-informed podcast, and then you had to bring golf into it.
I mean, that's how I got into mental health. So.
Golf is just the absolute.
The size says it all.
It's just the absolute worst. Like it is the absolute worst. And once it hooks into you, there's no unhooking. Like there's no. It's you're selling yourself up for failure, for constant frustration. Even when you win, you lose. It's the ultimate experience of understanding how alive you are, I think. So I mean, golf, we just enjoy it, right? We enjoy playing golf, and I've worked with golfers over the years that dealt with pain, right? The injuries from golf and coming back to it. And again, sometimes it's allowing your body to get into positions to even have the skill of it. But the challenge of it is so unique because all the factors are in front of you that most sports don't have. Right? The ball's in front of you, the weather conditions, you have the club, you have the hole, you see where to go, like you have the topography of the land, like everything's in front of you. And even the professionals suck at it. So it's a unique challenge, but there is also a big physical aspect to it. So our golf program was designed to be an in between traditional training and technical skill of it. So if a golfer goes to a golf professional to work on their skill, and the golf pro goes, here, you need to do this, and the person goes, I hear what you're saying, but my body literally cannot get into that position, right? That's where we would come in. Or if they get better and their body gets in that position, then they hit the ball and the ball goes 20 yards less than they think it should, but they know that the potential is in them. That's kind of where we come in. And then, of course, if people are
Hmm.
hurt or injured, low back pain is the most common issue, not just in golf, period. That's the biggest burden on the medical system is low back pain. It's kind of hard to perform when you are dealing with pain. So having like a specific skill set of that sports specific issue, that's kind of where we come in. So this kind of spectrum between dealing with pain, but also going, hey, it's not just about pain. We can add performance. We can help you with the skill of it. We're not teaching you the skill of it, but we're going to work with your body to get you in those positions that you know will improve your golf game, and allow the golf professional to help you with the skill of it. That's kind of where our golf program lives.
That would have been very helpful for me back in the day. There's so many more resources and information out there that can be helpful for people and young golfers and athletes alike to help boost their performance and also the mental, you know, anguish and things that come along with that.
Yeah, and it's kind of the nice thing about golf. Well, most kidding aside, it's something you can keep doing for almost ever, right? You can play into your 70s, 80s, 90s of teed off with golfers, um, and it's social, and you're outside. Like there's other aspects of health that comes with it that are just beyond hitting a golf ball. And it's so much more accessible than ever before, right? It always had this aura of it's just for wealthy people and well-off people, and pretentious, but it's growing and it's opening up, and it's I think it's a great avenue for a lot of people to experience frustration and fury outside in nature.
Outside in nature, which is always beautiful. It's a good place to be mindful. That's for
It
sure.
is. It is. You have plenty of opportunities to challenge your mental fortitude playing golf.
All right. And there you have it, folks. We're going to wrap up there. But a very special thanks to Dr. Gene for sharing his expertise and passion with us. And please be sure to check out Recharge Modern Health and Fitness and the podcast Movement is Medicine for more incredible insights. Gene, is there any place else people can find you or anything else you want to add?
No, that's perfect. I think it's a low blow finishing with golf, but it's
A low
a,
blow.
a little stroke, if you will. Um, no, this was great. Really enjoyed chatting with you. It's great having you as part of this community as a resource in mental health. If people haven't taken advantage of your services, they certainly should. That's I think a very unique combination as well of integrating a lot of um, dimensions of mental health from the traditional counseling to I think more integrative solutions is I think a good unique approach that doesn't happen too often. It's usually siloed in a lot of ways. It's been great having you here, picking your brain in a lot of ways, and teeing off with you playing golf.
Well, I appreciate you, brother. And until next time, keep moving, thriving, and remember that your body is your temple. Gene, thank you so much. Be well, my
See you
man.
soon.
All right. Take care. Bye.